8:22 at the Big 550 KTRS. Time for our weekly segment with Dr. Brad Freeman, who's a professor of surgery at WashU Medical School. Good morning, Brad. Brad, are you there?
Yes.
Oh, I'm sorry. Hi. So one of the stories I wanted to ask you about today, I don't know what you have on your agenda, but I wanted to ask you about this story that's been in the news the last couple of days of an outbreak of Legionnaires disease. I had not heard that phrase for about 30 years, and like we talked last week about leprosy, I thought we were done with Legionnaires disease.
Yeah, well, this is an interesting story, and Legionnaires disease, I think, burst onto the scene in the mid-1970s due to an outbreak in Philadelphia at the American Legion Convention, and at that time, it was an undescribed disease, and due to some very sophisticated detective work, they linked it. They were able to identify that it was a bacteria that lived in a contaminated water supply, and a large number of the attendees of this convention became critically ill, and many died. Well, let's fast forward now several decades, and we know what the organism is, and it's eminently treatable with bacteria, and typically it's not a big problem. But we've seen coming out of New York City now about 80 some odd cases since mid-July, and with several deaths to date. And it turns out that these were once again linked to a contaminated water tower in several residential buildings, which now have been contained and sanitized. So by and large, it's something that's eminently treatable, but once in a blue moon, if you will, we see these outbreaks, and by and large, the people that succumb to it are people that have a lot of medical problems and are somewhat frail.
So somebody with a weakened immunity system?
That's correct.
Yeah. And so why are these water supplies... Well, I guess I was going to ask why they're not being sanitized. I guess there could be a number of answers, but that's really the root cause of it. So it's nothing we have to worry about spreading to us.
I think it's highly unlikely. So these outbreaks, as you're aware, are turned out to be few and far between, and as any complex process, say sanitizing water towers or condensers for air conditioners and those types of things, breaks in the process can happen that can introduce bacteria into the system, just as we see sometimes bacteria introduced in the food chain. But so it's very rare. The general public certainly does not need to be alarmed by this. And again, I think New York City has done a very admirable job at identifying the root cause and addressing it.
And by the way, congratulations to the media for not going into freak-out mode over this the way they did about Ebola last year.
Absolutely.
And speaking of Ebola, I heard recently there's a vaccine for it now.
Well, so this is, we talk about a lot of negative things in healthcare and about costs and things that don't work and treatments that we used to think worked that doesn't work. But this is actually a positive story. And so, as you know, in the last year, Ebola has been a worldwide story, even though it was originating in very impoverished countries in Africa, including Guinea and Liberia and Sierra Leone, etc. Travelers traveled to industrialized area of the world, and we had to contain them, and even 2 or 3 Americans succumbed to this illness. So it was something that everybody was terribly concerned about just because there was not effective treatment. So the World Health Organization partnered with a number of nations. They have developed a prototype vaccine that they have now tested again in these endemic areas. And when I say endemic, it means areas where we see high incidence or prevalence of these diseases. And the first look at these vaccine trials suggests that they're highly effective, and in the initial run, it looks like it's totally protective. And so this is really incredible when you think about the rapidity with which the vaccines developed, the fact that there's no effective treatment for this disease, and that you're doing these kind of clinical trials of vaccines in a very under-resourced part of the world. So it's pretty amazing, and the way that they anticipate these vaccines will be used would be that when an outbreak is identified, that troops on the ground, or boots on the ground, would go in and vaccinate the population to, if you will, create a firewall around these index cases and essentially contain it. So this is a very promising and positive story.
And now that the vaccine has been developed, do we have the money to get it to the places where it's needed in Africa?
Well, I think that the devil is in the details, and I think that's why they're probably going to target this strategy of using it in areas where waiting for an outbreak and then targeting the population. I think if you look at how impoverished these countries are and the lack of basic medical infrastructure, I think it'd be very difficult to say go in and routinely vaccinate the entire population. So again, I think they're going to monitor for disease outbreaks and then go in and really concentrate on these populations that are at risk.
All right, last thing I want to ask you about today, Brad, is websites that say that they can help diagnose me when I'm wrong. I know that whenever I had any symptoms of anything, I used to go to WebMD, and no matter what it was, I had a back pain, I had a stomach problem, my head was hurting, whatever it was, the number one thing was I had to lose weight. I finally got the message, and I lost a little bit of weight. But what do you think about these so-called diagnostic websites?
Yeah, so well, as you know, and as you allude to, consumers return to the web very frequently for all types of information, including health information, and a number of websites have popped up which we call symptom checker websites. And the idea is if you develop a cough, or you develop a headache, or you develop joint pains, what have you, you would go to these websites and you would plug in your symptoms, and then they would provide information as to what the treatment might be or the urgency with which you might need to seek treatment, meaning do you need to go to the emergency department, can you wait and call your physician in the morning. So certainly there is potential value to this. So a group at Harvard came up with a number of clinical vignettes, meaning they created these simulated patients and then they went to a variety of these websites and said, how accurate are they? And it turns out they're not particularly accurate, meaning that they didn't get the diagnosis right in about 50% of the cases, and they tend to over-triage, meaning they would by and large be conservative with respect to what they would direct people to do, meaning they would frequently say you should go to the emergency department and that sort of thing. So
thanks for that help.
But I would say this is first generation, and I think this type of artificial intelligence, if you will probably become very sophisticated and in a short amount of time become very accurate and very useful. So I think that there's a lot of promise to these kinds of resources.
Yeah, but the important thing there is that you mentioned they get it wrong 50% of the time.
That is right. It's not particularly accurate as we speak in 2015.
Yeah,
let's see what happens in 2016.
It should be right now. When you type in your problems, it says you should really see a doctor about that.
That's what it does.
Go to the ER.
All right, Brad Freeman is a professor of surgery at WashU Medical School and a weekly contributor here to McGraw Live in the Morning. Thanks, Brad.
Hey, have a great week.
8:30 at the Big 550 KTRS.